This video will be about how to evaluate patients who present with acute monosymptomatic dizziness or vertigo. So, if we have such a patient who comes in with complaints of dizziness, one of the first things we have to do is to find out whether the patient has any other symptoms. If the patient experiences any other symptom, like for instance a headache, then this video is invalid. But even though we say monosymptomatic dizziness, as in dizziness is the only symptom, it is actually okay if the patient also complains of nausea and vomiting. We don't necessarily consider those as separate symptoms, as dizziness in itself can lead to nausea and vomiting. So, if the patient has a new complaint of dizziness and maybe nausea and vomiting, the next step is to look for spontaneous nystagmus. Nystagmus is a condition where the eyes make repetitive and uncontrolled movements. When we say spontaneous nystagmus, it means that nystagmus appear without any form of external stimulus. A common way for nystagmus to look like is that the eyes move quickly towards one side and then they move slowly back to their original position. And this movement will keep on continuing, repeating itself for some time. So based on this simple test, we will either be able to say yes, the patient has spontaneous nystagmus, or no, the patient does not have spontaneous nystagmus. But depending on whether we can say yes or no, we will have to do some completely different things. If the answer was no, then we have to perform the Dicks-Hallpike test. And based on the result of the Dicks-Hallpike test, we can either conclude with BPPV, which is short for benign paroxysmal positional vertigo, as the cause if the test is positive. If it is negative, however, then there is a completely different reason for the patient's dizziness. Typical causes are high or low blood pressure, side effects to medications, hypoglycemia, or electrolyte disturbances. On the other hand, if the answer was yes to whether the patient has spontaneous nystagmus or not, then we have to perform the HINTS examination. HINTS is actually a combination of 3 different examinations: HI for head impulse, N for nystagmus, and TS for test of skew. Together, these tests are indicative of whether we have a peripheral cause, that means a problem with the inner ear, usually a result of a simple virus infection of the vestibular nerve, or it can indicate a central cause, which means something inside the central nervous system. That can, for instance, be a result of a stroke or a tumor. Let's quickly look at each of these tests. For the first test, head impulse, start by grabbing the patient's head and tell him or her to look at your nose and keep looking at the nose. Afterwards, move the head slightly from side to side and make the patient relax his or her head. Then, suddenly, move the head quickly towards one side. Just as we turn the head, observe whether the patient can keep the gaze continuously at your nose. If the patient can keep the eyes at you, then it is actually indicative of a central cause. While if they lose contact with your nose, it is actually indicative of a peripheral cause. You will do this a few times on both sides. When it comes to nystagmus, we have to describe the different repetitive motions, and we have many points to look at, but I highlighted the most important points here. Typically, a central nystagmus moves with a low frequency and a high amplitude, and it can also be vertical and rotatory. A peripheral nystagmus has, on the other hand, a high frequency and a low amplitude. It is typically horizontal, and it does not get tired out. If you need more information in depth on nystagmus, check out my other video explaining nystagmus. For the last test, the test of skew, again tell your patient to look at your nose and keep looking at the nose. Afterwards, cover one of the patient's eyes with your hand for a few seconds and then quickly change over to the other eye. Observe the eye of the patient at the same time. If the eye of the patient is still in the same position after you remove your hand, it is indicative of a peripheral cause. But if the eye falls out of position, it is indicative of a central cause. Let's go back to the flow chart that we looked at previously. Based on the tests performed, we can either conclude with a peripheral cause for the dizziness, which typically is vestibular neuritis, a viral infection of the vestibular nerve, or a central cause, which can be a result of a stroke or a tumor. But this is important if only one of the hints examinations are suggestive of a potential central cause for the dizziness, then we have to have that as our tentative diagnosis. That is because a stroke or a tumor is much more severe than, for instance, vestibular neuritis, and any signs of it should lead to us to wanting to exclude or confirm it as a cause. Thank you for watching. I hope it has been educational, and if you have any questions, feel free to post them below. Cheers!